Asthma talk number 6. What is the treatment for asthma? Well, the first thing to mention is that there is no cure that we have at the moment for asthma, but there are a number of ways that we can try and make this condition very manageable, and certainly we would aim to make it not life-threatening. As mentioned before, sadly about 3 or 4 people a day in the UK die from asthma, and most of these are very preventable. So asthma treatments are normally taken as an inhaled medicine, meaning something which a person takes into their mouth and breathes into their lungs. The medicine is normally delivered as a powder, which a person inhales, or as a spray. So how do we approach the treatment of asthma? The first thing to do is to try and prevent an asthma attack. So even though we may not be able to stop somebody getting asthma, we can certainly try and reduce the frequency with which their asthma causes them problems. And that essentially it revolves around finding out which triggers there are for a person's asthma to play up, and then avoiding those triggers as much as possible. In terms of the medicines that we use, then the medicines come into 2 broad categories. Doctors will call them reliever or preventer. So a reliever medicine is an inhaler which a person uses as a quick fix, which doesn't last very long inside their body, but which gives them some fairly rapid relief. And reliever inhalers include things like Ventolin and other such reliever inhalers, Ventolin, salbutamol. These work quickly, but they don't last very long. The other broad category of inhalers are what we call preventer inhalers, and these have a variety of colours. And these are inhalers which a person uses on a more regular basis, normally every day, to try and bring down any inflammation and swelling in the airways, in the tubes, and that works on a longer term basis. It's important to note that the preventer inhalers do not treat an acute attack. An acute sudden attack when a patient's asthma deteriorates is normally treated with medications in the reliever inhalers, or sometimes those medications are given from the reliever inhalers, the same medication, but in the form of a nebulizer, which is the kind of spray. Occasionally, those same medicines which are in the reliever inhalers are given in the form of a drip. So those are the treatments for asthma, and it's important that the treatments are given in a coordinated and careful way with the doctor and the nurse. So nowadays we often encourage patients to have what we call a personal action plan, which contains information about what the various inhalers are for, how to make sure that the asthma is not getting worse, and what to do if your asthma does get suddenly worse. So inhalers are really not to be used in a random way. They're to be used in a careful way based on the advice of the doctor who is looking after the patient, and using the wrong inhaler can cause a person's asthma to become uncontrolled, and occasionally using the wrong inhaler or using the inhaler in the wrong way can cause an asthma attack, which may even lead to death. And many is the time that I've seen patients who have used their inhalers sadly in a very incorrect way and have become very ill. I've had patients, come across patients within the last year or two who have ended up on ITU several times because their asthma was not being controlled correctly, even though they had the correct medicines at home. So asthma inhalers are to be treated with respect, and patients, and in the case of a child, a parent needs to know exactly and very carefully which inhalers to use at which time, and that's what we'll talk about next.